So why do we care so much about stabilizing blood sugars with our fertility patients and our autoimmune thyroid patients? First of all, when we think about autoimmune disease, unstable blood sugars can trigger the immune system and increase the need for insulin, which in itself is inflammatory. And of course, inflammation, that word keeps on popping up throughout the day. Inflammation is one of the mechanisms by which autoimmune disease impacts our system and our health. And so anything that can lead to increased inflammation is going to aggravate an autoimmune condition. And we know that unstable blood sugars, and particularly high blood sugars that require more insulin to be produced in order to correct those high blood sugars, will be inflammatory. And we're always seeking ways to decrease inflammation overall. We also know that blood sugars, or unstable blood sugars, are one of the leading causes of fertility challenges across the country. And what we see happening with unstable blood sugars is that they're the underlying mechanism for polycystic ovarian syndrome. They can lead to a whole host of ovulatory issues which can make it hard to get pregnant. And then one of the leading complications during pregnancy is unstable blood sugars, which will both impact the health of the baby and the health of the mom. And the biggest, or I should say, the most known complication would be gestational diabetes, but you can also have things such as babies getting big, too big sometimes, so that you have to do a C-section. Can lead to hypertension and preeclampsia on the part of the mom. And we also have seen a lot of research coming out that shows that if a baby is exposed to unstable blood sugars in utero, particularly elevated blood sugars, they are more likely to genetically exhibit blood sugar issues in their own metabolism as they grow up.